Hi guys, welcome back to part 2 of my video about BPPV. So I hope you ended up watching part 1 because that's where I described exactly what this type of vertigo is. So today what I'm going to do now is walk you through basically how I'll assess a patient in the clinic, and then I'm going to show you some of my favourite balance exercises that I'll give to a patient after they've resolved from their symptoms. Okay guys, so I'm going to show you the manoeuvre that's used to help diagnose BPPV, and it's called the Dix-Hallpike manoeuvre. So Sophie here is going to help me demonstrate. What I'm going to do is essentially hold Sophie's head in my hands, I'm going to rotate her head towards me and slowly lie her back onto the plinth. Now, in someone who has vertigo, what's going to happen is they're probably going to feel very dizzy, very unwell, and very nauseous, and it can be quite severe, but these feelings will pass. So I like to encourage patients, even though it feels awful to bring on during the test, to try and stay nice and still. We'll know it's vertigo if it does kind of, peak up and then go away after, a couple of seconds. What I'll also be doing as the physio is looking into Sophie's eyes just to see if there is any nystagmus. So that is basically rapid flickering movements of the eyeballs. What that tells me is that there is a mismatch in communication between the inner ear and the eyes, also confirming the presence of BPPV. Alright, you ready, Soph? Mm-hmm. So, I'm going to hold Sophie's head towards me, and we're going to gently lie back onto the plinth, and I'm just going to hold her in this position. So what we should do is hold Sophie here, and I'll be checking in with her, but you're feeling pretty good, right? I like to hold the patient here until their symptoms subside, plus another 30 seconds just to make sure that they're all good to go. From here, if they do have BPPV, normally we'll just move into the treatment straight away, but in Sophie's case, there's nothing going on, we're feeling all good, so I'm going to set her back up. There we go. Perfect. So after I've assessed the patient and also treated their vertigo and they're starting to feel a little bit better, generally what I'll do is a bit further down the track is give them a couple of really good balance exercises that are going to be specific to them, just to help recalibrate that brain to inner ear connection after the BPPV has subsided, so that they can get back into doing all the normal things in their daily routine. So keep watching ahead in this video to see a couple of my favourite balance exercises that I like to give to my patients. Thanks!